To help us get some further perspective on some of the content of that report, we're joined now by the chairman, Chidicon Medical Center, Professor Philip Njemanze. Prof, it's always a pleasure to have you on the news. Just a key highlight from that presentation by my colleague, the migration policy that was initiated by this administration. I want your thoughts on it and its ability to actually help address the question of brain drain, because medical professionals continue to leave on a daily basis.
Yes, actually, the process of migration of medical staff, both nursing and medicine, is something that would be expected given the condition we find ourselves economically. The healthcare, the remuneration that is offered across the board is not sufficient to maintain a decent lifestyle for these health workers. But hope is not lost, because there are a few measures that can be taken that could help alleviate, at least in the short term, the problems we face. For example, extending the retirement age of doctors to 78 will give you a full cluster of manpower, which otherwise would have been out of the workforce. So I duly feel that this would help a lot to address the shortfall. And going forward, I think government should take a proper look at this measure.
All right, talking about the government taking a proper look, it's been over a year since President Bola Tinubu took power. What would be your assessment of his administration efforts to reform the health sector? And does it engineer some sort of hope that in the next 4 years we might see substantial improvement in the sector and perhaps, work more to reduce this migration we talk about?
Well, yes. The most urgent problem is, I think the lesser problem is the migration. The major problem that's facing Nigeria now is the outbreak of infectious diseases, as you mentioned in that report. Now, there are certain aspects of it that is a national emergency. It has come to know that so many laboratories, biolabs, are now operating across the continent, including probably some in Nigeria. This is a very major issue, that these biolabs are not under our control in Africa. These are usually biolabs for pharma, some foundations, and foreign governments. This should be a problem, because if there is a leak, if they are working on a virus or a bacteria, or there is any leak from this area, it will infect and cause a medical emergency that is beyond just the normal thing you can do. So I think what the National Assembly and the government should is to bring all laboratories within the area of Nigeria, within the West African area, region, and across Africa under parliamentary oversight. That means we must know no pharmaceutical company can come here and start conducting or doing some viral research. Everything must be under parliamentary oversight.
A lot, Prof, not to interrupt you, but of course we know that there's still a lot that needs to be done, and your suggestions are vital. But I wanted you to speak on what has been done by this administration in the past 1 year in terms of improving the health sector. Do you think it gives hope and perhaps improvement in a lot of health workers in the country?
I think it depends on who you talk to. If you talk to the residents in medicine, they will tell you that they still don't have any substantial offer that will make them stop migrating. If you talk to the private practitioners, we have been talking over 30 years on the health bank. So where people can go and borrow money at single interest rate loans. to build up hospitals and buy equipment, that this would drastically change the way medicine is practiced in the private sector. But this has not been done. There's an agricultural ban. Why can't there be a health sector ban whereby the loans are issued at single-digit interest rate? So the truth of the matter is that I commend the interest of President Bola Tinubu to the problems of the health sector. But a lot more needs to be done in a very methodological way, and this will not cost the nation so much money. For example, providing 100 billion to 200 billion naira budget for a health sector will transform the practice of medicine in the whole private sector across the country.
Well, let's see what. So sorry to interrupt you. I was just going to say, let's see what happens. He still has about 3 years, less than that, but who knows? We might just be surprised. Thank you very much, Doctor, for speaking with us.
Thank you for having me.